Hey guys, I will be presenting on rhabdomyolysis. My name is Robert Griffith. So, what is rhabdomyolysis? Rhabdomyolysis is a muscular disease that develops from the breakdown of muscle fibers. It can have a wide array of causes, and these causes are characterized by how they initiate the disease process. There's also a just as wide range of severity. One patient might have a subclinical case of rhabdomyolysis, and another patient have a life-threatening case of rhabdomyolysis. So some of the causes of rhabdomyolysis include myotoxic drugs like statins or antidepressants or beta blockers, physical traumas such as crush injuries. So a common example of this is when an individual's been in a car accident and their leg is pinned, and it really causes pressure on the muscle. When the pressure is released, that muscle will begin to swell, and rhabdomyolysis will set up. Overexertion is another cause, and it's most common in untrained individuals who are trying a very extremely high intensity workout. Infectious agents can cause rhabdomyolysis, and you can see in the graph that for young children, infectious diseases are the leading cause of rhabdomyolysis development. Inflammatory processes can also lead to rhabdomyolysis, and genetic orders may predispose an individual to developing the disease. So one common predisposing factor is sickle cell anemia, and that is an athlete with sickle cell anemia has to be careful about the way they train and when they train and the temperature and how hydrated they are. So the pathophysiology of rhabdomyolysis. So I'm going to start with the non-traumatic causes. And it has a few steps that are specific to it, and then it will lead into all rhabdomyolysis, to a pathophysiology that is characteristic of all types, all causes of the disease. So in non-traumatic cases, the myofiber ATP is reduced, whether that's from overexertion or a lack of glucose for the mitochondria to work with, or a lack of oxygen. There are many reasons why ATP might be reduced. But so ATP is reduced, and the muscle cells need a lot of ATP to carry out their normal function. One of the things they need it for is for protein pumps in the sarcolemma. When ATP is severely reduced, the sarcolemma pumps, such as ATP-dependent sodium-potassium pump, quit working. The sodium-potassium pump is important indirectly for maintaining calcium levels within the muscle fiber. So calcium builds up, and when persistent calcium buildup is in the muscle cell produces enzymes to get rid of the calcium. One of the side effects of these enzymes is it also destroys some of the cell bodies. So it destroys more mitochondria, which perpetuates the cycle because less ATP is produced. And it can also destroy the sarcolemma. So the destruction of the sarcolemma is where the rest of the rhabdomyolysis cases begin. And when the sarcolemma is broken down, components go where they don't belong. So even more calcium floods into the cell and flooding out of the cell. And it's all based on concentration gradients, just like anything else within the body. So flowing out of the cell are phosphates and creatine kinase and myoglobin. And these get into the circulation. And so when calcium gets into the muscle cell, it perpetuates the cycle of lysis even more. So more calcium's in the cell, more enzymes are being produced, more sarcolemma is being destroyed, more mitochondria are being destroyed. And it pretty much ends up in a total, the damaged cell is gone. And that's problematic because muscle cells don't regenerate. Another problem is myoglobin is, when it gets into circulation following muscle lysis, it overwhelms the binding capacity of plasma proteins that normally bind to myoglobin to protect the kidney from the protein. But when plasma proteins are overwhelmed, the myoglobin gets into the kidney tubules and it causes vasoconstriction, which can result in acute kidney injury. So some of the symptoms of rhabdomyolysis include, these are the most common. There are many other symptoms, but these, if a physician is suspecting rhabdomyolysis, these are the symptoms they'll see. So muscle pain and tenderness, muscle swelling, generalized weakness across the whole body, a dark urine, and some patients might not be able to urinate at all, or at least urinate very little. So some of the complications, as mentioned earlier, acute kidney injury. And acute kidney injury is very serious because it can lead to systemic organ failure. Disseminated intravascular coagulation. So what that is blood clotting throughout the body. It can lead to cardiac arrhythmia and cardiac arrest and hepatic inflammation, so liver inflammation. And pretty much all rhabdomyolysis cases have electrolyte imbalances based on the pathophysiology of the disease. So hyperkalemia and hypocalcemia, that means there's a lot of potassium in the blood and not much calcium in the blood. So the potassium, remember, is flooding out of the muscle cell and into circulation. And calcium is getting out of circulation and into the damaged muscle cell. So how is it treated? Rhabdomyolysis is treated using IV fluids. A particular note with crush injury victims, before the pressure is relieved from the muscle, an IV should be started, because if IV is not started beforehand, the disease process is much worse. So with rhabdomyolysis, if a patient is admitted to the hospital stay is probably going to be pretty lengthy, up to a week normally. As seen in the graph, up to 11 or 12 days. Acute kidney injury will require dialysis to treat. That is my presentation on rhabdomyolysis. Thank you.